Can you stop osteoporosis medication with a drug holiday? Have you ever wondered if it's possible to take a break from osteoporosis medication? The answer is yes, but it comes with important considerations. This approach is known as a drug holiday. It primarily applies to bisphosphonate medications, which are commonly used to treat osteoporosis. However, this decision should always be made in consultation with a healthcare professional. A drug holiday is a planned break from medication after a period of continuous treatment. Typically, this is considered after 3 to 5 years of using bisphosphonates, especially for patients who are at low risk of fractures and have stable bone density. Bisphosphonates include medications like alendronate, risedronate, and zoledronic acid. These drugs work by binding to bone and can continue to provide benefits even after stopping treatment. The main goal of a drug holiday is to reduce the risk of rare but serious side effects that can occur with long-term bisphosphonate use. These side effects include atypical femur fractures and osteonecrosis of the jaw. While on a drug holiday, patients can still maintain some protection against fractures due to the lingering effects of the medication. Guidelines suggest considering a drug holiday after 5 years of oral bisphosphonate treatment or 3 years of intravenous treatment, provided the patient has not experienced any new fractures and their bone density remains stable. However, this strategy is not suitable for all osteoporosis medications. For instance, denosumab, another osteoporosis treatment, does not have a lasting effect once discontinued. Patients using denosumab need to either continue the treatment or switch to another therapy to avoid rapid bone loss and increased fracture risk. When contemplating a drug holiday, several factors must be taken into account. These include the patient's fracture risk, the stability of bone mineral density, any history of fractures, the duration of prior treatment, and the potential side effects. High-risk patients are generally not candidates for a drug holiday. During a drug holiday, it is crucial for patients to be closely monitored. This includes periodic bone density tests and clinical assessments to check for any signs of bone loss or increased fracture risk. If bone density decreases significantly or if fractures occur, it is usually recommended to restart treatment. In summary, drug holidays can be an effective strategy to balance the benefits and risks of long-term bisphosphonate therapy in managing osteoporosis. However, they require careful patient selection and ongoing monitoring by healthcare providers. Remember, this is not a permanent stop to treatment but a temporary pause. Always consult with a healthcare professional before making any changes to your osteoporosis medication.